Hello, this is Dr. Matt Joosse at Joosse Family Orthodontics. I like to show off interesting and unique cases, and this is certainly one of them. Not for the tooth movements that you're about to see, but because of why the teeth were able to move. So this is Teresa, and Teresa came to us actually from her general dentist where she was pursuing Invisalign treatment, and she told us that the teeth were not moving like they should be, and so she wanted to see if we could do better. And, you know, I had a little bit of a hesitation because Teresa was on a class of medications that's given to promote bone health. So sometimes as we age, well, let me say it this way, our bones are constantly remodeling. They're constantly being kind of eaten up and then built back up by cells within our body. And as we age, and particularly for women, as we age, the process that the bone gets eaten up, that happens at a faster rate than the bone gets built back up. And so this is when you hear about osteoporosis, and particularly in older women. And so this class of drugs is to prevent the kind of the eating up of the bone, and then that way it kind of levels the playing field. Whereas when the bone is getting built back up, now we're not in imbalance, we're not getting weakened bones. But what most people don't know is this: teeth move by the same process by which bones are remodeling. And so if we do something to shut down the remodeling of our bones, which is the exact class of drug that Teresa here was on, theoretically, teeth can't move. Now, there is a little bit in the literature about how those drugs are given. If those drugs are provided orally in pill form, tooth movement may still be possible. If it's given in IV form, tooth movement is very unlikely. So we'll talk about that as we go through treatment here. But this is a picture of Teresa's lower teeth. You can see that there's a little bit of crowding in the lower front teeth. Here are her upper teeth, a bit more crowding and a bit more kind of misalignment of the upper front teeth. And then you'll note her bite, and particularly how some of these upper teeth are not to the outside of the lower teeth. And we have these two areas in the front where you can kind of see clear through between the upper and the lower teeth. So we initiated Invisalign treatment with Teresa, and in the midst of her treatment, she actually switched from the oral version of these drugs to the IV version of these drugs. So it made me very skeptical about what was going to happen, but we'd already been seeing great tooth movement already. And so this is where we ended up with Teresa, and you can see just a huge change between those upper front teeth. And this is again where we started, and this is where we finished. So great changes. We have a little bit better bite here in the back of the mouth as well. And if we break it down, we can take a look at those upper teeth, and they're really nice and perfectly straight here. And here's Teresa's smile. So she was just ecstatic about the difference in her smile. And, just to show you a couple of comparisons. So this is where we started and where we ended up. And so we see a dramatic difference in the change from where we started to where we ended up. And then here are the upper teeth. Again, a huge change from where we started to where we ended. So we're really happy with these changes as well. And then we see the lower teeth having gotten a lot straighter as well. So, this is a particularly interesting case to me because theoretically the teeth should not have moved. And we certainly had a great patient, a great partner in treatment who did all the right things during her treatment, especially with the wearing of her aligners. She was religious about wearing them for at least 22 hours a day, and she got some amazing results. So I throw this one out there as, just an interesting case. It doesn't mean that this would happen in all of the patients who are on these class of medications. We certainly can't expect this kind of success whenever we have a patient on IV bisphosphonates. That's the class of drug. And we shouldn't expect this type of success even with oral bisphosphonates. But it is possible. And so I think that the important takeaway here is if you're interested in orthodontic treatment and you're on bisphosphonates, number one, there's a difference between oral bisphosphonates and IV bisphosphonates. Oral bisphosphonates should have better orthodontic success. IV bisphosphonates less successful. But even with the IV bisphosphonates on board, orthodontic tooth movement can still be possible. And so as long as you're aware of the risks that things are not going to move, sometimes it's okay to try. and sometimes we end up successful. So thanks, Teresa, for being a great partner in treatment. Hope you learned something today by listening to this video. Thanks so much.